Hey everyone, welcome back to Corporate Decoder, the place where we unpack the cryptic language of business and finance to reveal the juicy secrets hidden within. Today we're diving into Acrivon Therapeutics and their latest 8K filing, which is packed with some pretty interesting updates on their drug development and their financial runway. Before we jump into the nitty-gritty, make sure you're subscribed and hit that notification bell so you don't miss out on any of our deep dives. Also, we've got a fantastic community over on Discord all about dissecting these financial reports. So join us there, the link is in the description below. Alright, so what's the big story here? Acrivon Therapeutics Incorporated is telling us about their financial health and some really important clinical trial data. They've got about $119 million in cash equivalents and investments as of the end of 2025. Now that sounds like a lot of money, and it is. But the key takeaway here is that this amount is expected to keep their operations going into the second quarter of 2027. This basically means they have a solid amount of time to keep pushing their research forward without needing to scramble for more cash immediately. They're being super clear though that this 119 million is a preliminary number and the final audited figures might be a bit different. You know how it is with these early estimates. This section is all about their financial status. The crucial piece of information is that estimated cash balance. Think of it as the company's fuel tank. Having enough fuel to run for over a year is generally a good sign for a biotech company. It gives them breathing room to navigate the long and often expensive process of drug development. Now let's talk about the science, the really exciting part. Acrivon is making progress with a drug called ACR-368. This is a potential first-in-class treatment, which means it could be the very first drug of its kind targeting specific pathways in cancer cells. They are seeing promising results in endometrial cancer. In one part of their trial, which is looking at patients with certain markers called BM-positive subjects, they are seeing a 39% objective response rate. Digging deeper into patients who have had fewer than 3 previous treatments, the response rate bumps up to 44%. What's even more interesting is that they are focusing a specific part of their trial arm, 3 exclusively on patients with a more aggressive type of endometrial cancer called serous cancer, and who have had 2 or fewer prior treatments. This is where the data gets really compelling. In this specific group of serous endometrial cancer patients who are BM positive, the confirmed objective response rate reached a striking 67%. And when they looked at all serous cancer patients, regardless of whether they had BM positive or BM negative markers, the confirmed response rate was 52%. Compare that to the 22% response rate in non-serous endometrial cancer patients and you see a significant difference. This suggests that ACR-368 might be particularly effective against serous endometrial cancers, which often have a weakness related to DNA damage repair. They are also expanding this trial into Europe with applications submitted and expecting to enroll patients there in early 2026. This is a big step for global reach. The European expansion is a key milestone. It means they are not just relying on US data, but are aiming for wider validation and potential market approval internationally. They're also looking ahead to a phase 3 study for ACR-368 in combination with an anti-PD-1 therapy for first-line advanced or recurrent endometrial cancer in patients with a specific genetic profile called pMMR. This shows they have a clear strategy for how to move this drug forward if the current trials continue to show positive results. Next up, we have ACR-2316, another potential first-in-class drug targeting different pathways in cancer cells. They are studying this in a phase 1 trial and have dosed 33 patients so far. They've identified 2 weekly oral dosing schedules that appear to be well tolerated. Importantly, they are seeing some clinical activity with tumor shrinkage observed in a good number of patients. One patient with endometrial cancer who had already gone through several treatments achieved a confirmed partial response and stayed on the drug for an impressive 42 weeks. They're also seeing unconfirmed responses in patients with small cell lung cancer and non-small cell lung cancer types that haven't always responded well to similar drugs. This indicates ACR-2316 might have broader applications than initially thought. This specific case of a patient responding for so long is a really strong indicator of potential durability for ACR-2316. While it's still early days, seeing this kind of sustained response in tough-to-treat cancers is exactly what you want to see at this stage of development. They are also exploring different dosing schedules to maximize effectiveness and flexibility for future combination studies, which is smart strategic planning. Finally, Acrivon is introducing ACR-6840, a potential first-in-class inhibitor for a target called CDK11. This is the next development candidate from their AP3 program. CDK11 is described as a challenging but compelling target involved in several critical cell functions like gene regulation and cell division. Acrivon designed ACR-6840 using their AP3 platform to hit this target effectively. They are aiming to submit an investigational new drug application for this in the fourth quarter of 2026. This tells us they are actively diversifying their pipeline and using their core technology to tackle new and complex biological targets. Looking at upcoming milestones, Acrivon expects to start enrolling patients in Europe for their ACR-368 trial in the first quarter of 2026. They'll also provide more updates on ACR-368 in mid-2026 and aim to be ready for a phase 3 trial around the same time. For ACR-2316, they anticipate reporting more phase 1 data and moving into dose expansion studies in the first half of 2026. And for ACR-6840, the new candidate, the INDed submission is slated for the fourth quarter of 2026. These are concrete timelines that investors and observers can look forward to. Now, every filing like this comes with a section about forward-looking statements. This is basically the company's way of saying, hey, we're making predictions about the future, but things could change, and these predictions aren't guarantees. They mention a lot of factors could cause actual results to differ from these predictions, including risks and uncertainties described in their SEC filings. This is standard legal practice, but it's always good to remember that the future in biotech is highly uncertain. Now, for my take on all of this, Acrivon Therapeutics is showing a lot of promise. Their cash position gives them a healthy runway, meaning they have time to execute their development plans. The data on ACR-368, particularly in serous endometrial cancer, is very encouraging, and the move into Europe is a significant step towards broadening their reach and potential market. The fact that they are seeing responses in patients who have failed multiple prior therapies speaks to the potential of their approach. With ACR-2316, they are demonstrating that their platform can generate potential treatments for challenging cancers, and the early signs of activity are quite positive. And the introduction of ACR-6840 shows a commitment to ongoing innovation and leveraging their AP3 platform for new targets. The main risks here, as with any biotech company, are the inherent challenges of clinical trials. Not every promising drug makes it through. There are always regulatory hurdles, manufacturing complexities, and the ever-present possibility of unexpected side effects or lack of efficacy in larger patient populations. For Acrivon, investors should keep a close eye on the interim data for ACR-368 as it progresses and monitor the patient enrollment numbers for their various trials. The success of these trials will directly impact the company's valuation and future prospects. Overall, Acrivon appears to be on a solid trajectory with multiple promising candidates in development. They've got the financial foundation to continue their work, and the scientific data so far suggests they are on the right track. Alright, that's our deep dive into Acrivon Therapeutics' latest filing. What do you think about their progress and their drug pipeline? Let us know in the comments below. If you found this analysis helpful, please give it a thumbs up and don't forget to subscribe for more corporate decoder insights. And as always, join our Discord community linked in the description to keep the conversation going. Thanks for watching, and we'll see you in the next video.